Hi, I'm Dr. Michele Lee, a board-certified ophthalmologist and cataract surgeon. You're probably watching this video because you are thinking about cataract surgery. So in this video, let's talk about what to expect before, during, and after your cataract surgery. A cataract is a cloudy lens inside your eye that we will all develop over time. Most of us will develop a visually significant cataract that we will want to address in our lifetime. There are certain factors that can predispose you to having earlier cataract surgery, such as genetics, certain medications like steroids, and certain systemic diseases like diabetes. The right time to do cataract surgery depends on your visual needs, and that can vary from person to person. The general consensus is that it is time to do cataract surgery when you are struggling to do the things that you want to or need to do because of your vision. When you've reached that point, it's time to consider cataract surgery. I like to think of your natural lens inside your eye like a peanut M&M. You have a candy coat on the outside, chocolate, and then a peanut in the middle. The actual cloudy part of your natural lens is the chocolate and the peanut. Your candy coat is actually a clear layer that is attached to the wall of your eye. During your surgery, we try to keep that candy coat intact. We make a little opening in that candy coat. We use an ultrasound machine to take out the chocolate and the peanut. We leave that candy coat mostly intact. The lens goes through a small incision and then opens up inside that candy coat. A routine cataract surgery takes about 5 to 10 minutes on average. If you have a complex anatomy, risk factors, or have any add-on procedures, the surgery will take more time. I do the majority of my cases under conscious sedation, where you are awake but not really aware. You have an anesthesiologist at our surgery center who will give you some sedation through an IV so that you are comfortable. There is a 1% chance of complication even in a routine cataract surgery. There is a 1 in 2,000 chance of a visually threatening infection developing inside your eye, usually within 1 week of cataract surgery. It's very important that if you have any brand new symptoms, such as sudden eye pain, sudden loss of vision, flashing lights, or floaters, that you call us right away so that we can rule out an infection or any other issues that may come up after surgery. The most common side effect that we hear about is worse dry eye after surgery. There are many reasons why your eyes get much more dry after surgery. If your provider is recommending any over-the-counter or prescription eye drops for your dry eyes, it is important that you work on this, as the dry eyes will get worse after surgery, and having dry eyes during your preoperative appointments and during the surgery may affect the results of your surgery. Another very common side effect of the surgery is that you can develop a membrane or scar tissue behind that new lens that is implanted after surgery. This is called a posterior capsular opacification, or PCO. It is very common. Most people will develop some degree of this scar tissue, and about 30 to 50% of patients will require a laser procedure to remove that scar tissue to help with their vision. And this can occur anywhere from months to many years after the surgery. We typically like to wait at least 2 to 3 months after surgery to allow time for the eye to heal before we proceed with this laser. On top of that, it's very common to have some visual symptoms, such as new floaters, as well as light or shadows that can develop on the sides of your vision, called dysphotopsias. These can be quite annoying. They typically disappear or become less noticeable after about 3 to 6 months. Once you decide that you want to move forward with surgery, the next big decision is going to be which lens type you want to pursue. Your lens options are very individual to your eye and your needs, so part of your discussion with your surgeon will include a discussion about which lens you may want to consider for your surgery. There may be a lens that works well for one person but may not work well for another. We do not have a perfect lens, and we can never get your 20-year-old eyes back. We do have lenses that have special properties that may be able to help you achieve any refractive goals that you may have. In this video, I will run through some options that I like to offer my patients for cataract surgery, but make sure that you're having a candid discussion with either myself or with your cataract surgeon so that you know which lens options are the best ones for you. In the United States, the cost of cataract surgery includes a standard lens. This is a lens that is a very simple lens. It's the same power throughout. It does not correct any astigmatism. It does not give you any kind of a range of vision. If you're okay with the idea of wearing glasses after surgery, whether it be part-time for computer and reading or full-time for distance computer and reading, there is nothing wrong with the standard lens that's covered by insurance. The majority of people who get the standard lens will have their eyes set for about distance vision on both eyes, and then will wear glasses either full-time or part-time for reading. This is great for those who want to keep things cost-efficient or for those who have to or want to wear glasses after surgery. If you would like to be more spectacle independent after cataract surgery, there are two ways to achieve this. The first way is to do something called monovision. That's where we set one eye for distance and one eye for intermediate or reading. If you don't have astigmatism and you have pretty healthy eyes, you may be able to achieve monovision using a standard lens where you set your dominant eye for distance and your non-dominant eye to your desired intermediate or near focal point. If you have astigmatism, you can still achieve monovision by correcting the astigmatism either with a laser or with a lens called a toric lens that offsets the astigmatism correction on your cornea so that all the light rays focus at one point on your retina. With the appropriate astigmatism correction, you can focus your dominant eye for distance and your non-dominant eye for computer or reading. It can be very risky to do monovision if you've never tried it because some people have a hard time adjusting or tolerating monovision. Anyone with any balance issues or vertigo should probably not get monovision, as monovision will affect depth perception and potentially cause worse balance issues. If you're looking to have a better range of vision, but you are worried about monovision, another option would be a class of lens called presbyopia correcting lenses. The most popular of those lenses is the multifocal lens. These trifocal lenses have 3 focal points: distance, computer, and reading. We are very picky about who qualifies for a multifocal lens. If you have any significant eye disease in your eye, for example, if you have early signs of macular degeneration, or you have any corneal irregularity or diseases, you are not the best candidate for a multifocal lens. If you are not a good candidate for a multifocal lens or a trifocal lens, there is another class of lenses called an extended depth of focus lens. This lens is a little bit more forgiving. Instead of having 3 focal points, it offers a blended range of vision, and it is an appropriate lens for patients who don't have a perfect eye but wants to have some range to their vision. The last category of lens that I'm really excited about are the light adjustable lenses. This is my favorite premium lens to offer patients because it is very precise and very flexible. What we do during the surgery is we just put in the light adjustable lens and set both eyes to approximately distance vision. After the surgery, the lens is adjusted using a light treatment in clinic. And what I love about this lens is that there's a lot of flexibility and precision to what we can do. If you've ever had any kind of cornea surgery, such as LASIK, PRK, or RK, your lens calculations are not as accurate given the abnormal anatomy of your eye after these procedures. What's great about the light adjustable lens is even if we're far off from your prescription, we can adjust the power of the lens using a light treatment in clinic so that we can make your results as precise as possible. If you are interested in some version of monovision where you have one eye for distance and one eye for computer or reading, but you've never tried it before, you can actually use the light adjustable lens technology as a way to try out monovision and see if you like it before you commit. You have the ability to go out in the real world and try it for yourself, bring some feedback, and have things tweaked and adjusted accordingly. There is a bit of a time investment. You will have to come in frequently to get adjustments. And also you do have to be very careful about wearing UV protecting sunglasses when you are outside so you don't accidentally damage your lens. It's very important on the day of surgery that you have a driver because you will have some sedation in your system, and we want to ensure that you get home safely. On top of that, it is very important that you avoid bending over for 3 days. It is also very important not to do any heavy lifting more than 20 pounds and no swimming or hot tubs for 2 weeks. Make sure you follow all of your eye drop instructions and any customized instructions that your provider may give you. If your vision is not perfect the day of or the day after surgery, Don't worry about that. It's very normal for the vision to be pretty blurry. And while some people may have great vision by their first day out from surgery, many people require 2 to 3 days or sometimes even longer for their vision to start clearing up. A few weeks after surgery, you'll be good to get a glasses prescription or a contact lens prescription if you need it. After that, go out and enjoy your new vision. If you like this kind of content about cataract surgery, feel free to check out my personal YouTube channel, Michele Lee MD, for a lot more detailed information about cataracts and cataract surgery. I hope you found this video helpful, and I hope to see you soon.